you know there's a painkiller that can reduce your menstrual pain and also what your menstrual blood flow? And what is that drug? The drug is called mefenamic acid. This is a drug, we call it mefenamic acid. After ovulation, when pregnancy does not occur, fertilization does not occur. What happens is that the female reproductive hormone, which is estrogen and progesterone, they are going to be low in the body. And what this estrogen and what and progesterone they are low in the body, it will lead to what endometrium to be what to be shaded. This is the skin lining of the what of the uterus. Now, once this uterus, the skin lining of the uterus, which is called endometrium, it's shed off like it's removing as you are rolling the carpet. Now, once it's removed in the body, it lead to what? It lead to what? Increased it lead to destruction on the what cell membrane of the uterus, and thereby it will lead to what? It will lead to flow of blood in the body. And once this skin lining of the uterus is affected, it will destroy the what? The cell membrane. And the cell membrane now it will break down to what? Phospholipid, to arachidonic and prostaglandin. And once it's come to prostaglandin now is responsible for the what? Uterine contraction and also what? Pain that is being experienced during menstruation. And this uterine contraction it leads to what? Once there is uterine contraction, it will lead to increase in what? Blood flow and also what? Causing what? Menstrual pain. And what does this mefenamic does? Mefenamic, what it does that it comes to this arachidonic acid to prostaglandin. There are some enzymes that is present in it that is causing those prostaglandin that is making the uterine contraction to be contracting, that is making the blood flow to be what? To be increasing and also causing pain. Now, this mefenamic acid, it will now block this what? This enzyme that is causing prostaglandin to be having what? Uterine contraction and pain. And once it stop the uterine contraction, it will lead to what? Reduce in what? Blood flow and also what? Pain. And it has been found that mefenamic acid is very effective in what? In menstrual pain. And what are the other uses of mefenamic acid? We said that it's very effective in menstrual pain and than other NSAIDs. And it also reduce inflammation like other NSAIDs and also reduce fever. And what are the adverse effects of mefenamic acid? Is nausea and vomiting, and also what? Skin rashes are also what? Can also occur, and abdominal pain, and it can also what? Can also cause peptic ulcer and GIT bleeding, and also what? Thrombocytopenia in the what? In the blood. If you find this video helpful, please like, share, and comment. Thank you.